Hi, this is Dr. Jaimie with Concierge Mobile Animal Hospital. This is Freddie Bea. As you can tell from her only one eye, she is definitely no stranger to having eye medications put in. So that's what we're going to talk about today. She actually had one eye surgically removed, but the other eye still gets medications. So we're going to show you today how to do eye drops and eye ointments. The thing I want to stress the most is positive reinforcement. We want to make this a positive experience because it is scary for them, and if we're constantly making it negative, then they're going to shy away from you. It's going to be a lot harder. So I'm just going to set her down for a second. There you go, Freddie Bea. Stay right there. Give her a little cookie. And I'm going to show you our morning routine and how positive this is for her. So we keep our eye meds in the kitchen. Every morning I come out here, grab some COOKIES, and Freddie Bea, do you want your eye drops? Freddie, eye drops? Freddie, you want to get your eye drops? Yes. And we obviously have to help our little friend too. So she no longer needs to have a towel, but I am going to show you a towel restraint so that it'll help you in case your dog's not as used to it as she is. So we sit up here, we make sure we have everything ready that we need. Come here, love. She doesn't know why I'm putting the towel on her. She's like, this is easy. So I just use the towel around her neck. And depending how wiggly your dog is, you can actually tuck it all the way underneath. What that does is it keeps them from pawing with their front feet or even scratching at you with their back legs, and it kind of isolates her. I make sure she's in my lap so that she can't back up. One very common thing that we do is we come at them from the front and they'll back away from us. So if she's in front, she's in front of me, she can't go backwards. So I'm going to show you the eye drops first. I know. So what I'm going to do is I'm going to tip her head back. I'm going to use one finger to open her upper lid, and one finger to open her lower lid. You have to find a hold that's comfortable for you. You don't want to tip the edge of the eye drops all the way into the eye because you want to keep these sterile. And she wiggles a little when I do it, but it was that easy. So you keep the dropper about an inch or two off of her eye. It's that easy. You're done. And we give her a cookie. Always give them a reward. Yes, that's a good girl. Now let me show you the eye ointment. The eye ointment can be a bit trickier because it's quite goopy and messy. This is a large vial. Sometimes they're very small, so it just depends which medication you have. You're gonna do the exact same thing. So you're gonna use your thumb or a finger to hold one open and the lower open, and you're just gonna squeeze. I know you don't like this as much. You wanna put it directly on the eye. And what happens when you get it directly on the eye, again, I didn't touch the eye with the tip because I wanna keep the tip sterile and clean, and I don't wanna do any damage to the eye. But what happens is she naturally closes her eye, and that spreads the medication. If you have any concern about the medication getting in, you can open and close their eyes a little bit for them. That will kind of help to disperse the medicine. If you look, you can see that a little bit of it actually is coming out. Nothing we need to be worried about. You can clean it off with the towel, or you can even leave it if it doesn't bother you. And when you're done, same thing. Do you get a cookie? Freddie, do you want a cookie? Yes. And we continue to make it a positive experience. That way the second time she has to do it, the third time, the 100th time she has to do it, the whole experience is a lot easier. Thanks, have a great day.